Is an osteoporosis diagnosis truly serious? When you hear the word osteoporosis, it might sound like just a condition related to weak bones, but in reality, it is much more significant. Osteoporosis is a skeletal disorder characterized by a decrease in bone density and deterioration of bone tissue. This makes bones fragile and more likely to break from minor falls or even everyday activities. The seriousness of an osteoporosis diagnosis comes from the increased risk of fractures, especially at critical sites like the hips, spine, and wrists. These fractures can lead to long-term disability, loss of independence, and even increased risk of death. Hip fractures are particularly concerning because they often require surgery and can lead to complications such as infections or blood clots. About 1 in 5 people who suffer a hip fracture die within a year, often due to the injury itself or other health issues they may have. Even among those who survive, many experience a decline in mobility and quality of life. Spine fractures are also common and can cause chronic pain, deformity, and height loss, further affecting daily functioning. Osteoporosis is not just about broken bones. It has systemic health implications. Research shows that people with osteoporosis have a higher risk of death from cardiovascular disease and other causes. Studies suggest that osteoporosis can increase the risk of overall mortality by about 50 to 60%, even after accounting for other health conditions. This highlights that osteoporosis affects more than just the bones. It impacts overall health and longevity. The condition becomes more common with age, especially in women over 65. Women over 80 with osteoporosis face a high chance of experiencing a hip fracture within 5 years. This risk remains significant even when considering other health factors. Because of this, early detection through screening is vital. Bone density tests can identify osteoporosis early, allowing for interventions that can help strengthen bones and prevent fractures. Treatment options include lifestyle changes like diet and exercise, medications that help maintain or increase bone density, and fall prevention strategies. While osteoporosis is a chronic condition that requires ongoing management, early diagnosis and proper care can significantly reduce the risk of fractures and improve quality of life. In summary, an osteoporosis diagnosis is truly serious because it signals a high likelihood of fractures that can cause lasting disability and even threaten life. It also has broader health implications that make managing the condition crucial. If you or someone you know is at risk, consulting a healthcare professional for assessment and personalized treatment is the best step toward protecting long-term health and well-being.